Hi, what we're going to go through today is looking at how to secure a nasal ET tube on a child. This is obviously a big mannequin, but the same principles apply for whether or not this is a small baby or an older child. The equipment that we've got ready in preparation for this is a elastoplast already pre-cut and some duoderm or skin protection tape. For an equipment point of view for my patient, I'll make sure that I've got somebody who's assisting me in holding the ET tube. I've got an appropriate size airway and mask and an ambi bag just in case we lose any oxygen supply. Also in preparation for this, I've moved the nasogastric tube out of the way, and I've got some damp gauze that I can wipe the child's face if the face is mucky and the tapes won't secure properly. Okay, are you all right there, Joe? Mm-hmm. Right, so first thing I'm going to do is apply some duoderm along the child's cheek, close up to the nostril, on both sides. This just protects the child's face from the elastoplast. Okay, and I'm working closest to the side where the ET tube is in the corresponding nostril. This is one procedure that I don't do with gloves, but as you'll soon see, it's quite a sticky procedure, so if I wear gloves, I'll get stuck to them. So with my first trouser leg, I'll apply that closest to the nostril where the ET tube is. Okay, sorry Joe, right, now I fold this one that's going to go around the tube underneath first. Try not to stick to Joe's hand. The first trouser leg will go over the bridge of the nose, avoiding the child's eyes, come back on itself and go down the opposite cheek on top of the duoderm. This trouser leg now will go underneath the tube, and just make sure we've got the right, still in the right position before we secure it. Wrap around itself once, trying to avoid sticking on the child's nostril, come back on itself, and then secure along the child's cheek. You can see we're aiming to keep the tube pointing southwards to avoid any pressure on the delicate nostril. And then with my second trouser leg, I'm now going to do the opposite. Again, bringing where it divides closest to the nostril. And now we're going to go the opposite way around. So with my bottom trouser leg, I'll go again along the top of the lip, trying to avoid sticking on the lip, and coming down along the cheek. And then with my final trouser leg, come up the bridge of the nose, secure around the tube, again wrapping around once. You might need to move your finger just there slightly, Joe. Move further, that's it, brilliant. Coming down on myself along the tube and then back down along the child's cheek. You can see there's some excess tape here, and I can just trim this down. And I always make sure I cut along my finger, just to make sure that we don't inadvertently cut the child. And just do the same on the opposite side. Okay, right, so what's left is just to secure the nasogastric tube. See, I've secured that to the child's forehead. Can I get you to hold that, Joe? Mm-hmm. That's it. Okay, Joe, you can go now. You can see we've secured the nasogastric tube above the ET tape, so that if you need to manipulate the nasogastric tube, you can do so without removing the tapes. There you go, a secure tube.